I'm Susan Boyd from the University of Victoria, and I was so interested in the conference, especially in relation to the title, Carceral cultures, because for years I've been looking at how our drug laws or drug prohibition impacts other institutions and practices. For example, our social service policy or child protection policy is based on ideas that accompany drug prohibition about the harms of drugs and that drug use equals bad parenting and that those children are in need of protection and apprehended then. It also shapes our health care and our health services so that certain types of treatments and drugs that we can use for treatment are restricted by the federal government, and doctors are told the type of practice that they can have through our drug laws, and the type of drug treatment that we can set up is determined through our drug laws as well. So I'm interested in how drug laws impact a much wider range of practices, but when we look across the world, we can see globally that for many nations that the larger majority of prisoners are there for a drug charge, and for women especially this has become increasingly more so over the last 30 years, and where even up to 60 to 80% of the prison population of women are there for a drug charge. And in Canada, it's about 28% of women in federal prison are there for a drug charge. And we know that many more women in provincial prisons as well are there for a drug charge or justice administration. So it's just the idea of looking out at the prison culture as well, but looking outside of it and how women and men are regulated through these other institutions and the policies that we've created that abide by drug prohibition laws.